to take action as well.
It's for prisoners costing tens of thousands of dollars, and you're paying for it. Hepatitis C is one of the most common diseases and can carry a death sentence. And it runs rampant behind bars.
But with tight budgets, many are wondering, should prison inmates be given the most expensive, top-of-the-line medications?
I was living at one point in my time in my life as a youth pretty recklessly.
Life for Paul Sousa was filled with drug use. He says it was destiny. He just did what he saw his mom and dad do, two hippies who lived to party. And the party did not end when in 1992, Paul tested positive for hepatitis C.
It just kept popping up, and I just knew that I had to have had it. And then I found out that I did. It was no surprise.
He lived with the disease until 2007, when he made the decision to turn his life around, get off the drugs, and rid his body of the deadly disease. Hepatitis C is one of the most prevalent diseases in California's prison system, spread by sharing needles used for drugs and tattoos. More than 15,000 have tested positive. About 400 are being treated, most with older but effective medications.
We make them wards of the state. We have some responsibility to safeguard their health.
Dr. John Zweifler oversees the Hep-C care of California's inmates. He also sits on the Hep-C Oversight Committee, the very one that decided to add two brand new drugs to their approved list for medications. Those meds can add more than $50,000 per course of treatment per inmate.
We focus our hepatitis C care on those patients who have more advanced disease, but are those who are most likely to benefit from the treatment.
The new meds, boceprevir and telaprevir, are supposed to double the Hep-C eradication success rate from 35% to 70%. The Department of Corrections and Rehabilitation is now treating 50 inmates with either of them, adding an estimated $2.5 million to their already expensive treatment. They began in October of last year, so it's too early to tell if they're effective.
We haven't seen anything that would still, in our mind, justify the more expensive treatment when there are less expensive alternatives out there.
Taxpayer advocate John Kupal also points out the inequality for some honest, hardworking people whose own insurance plans will not cover these high-cost meds.
Convicted felons, some of very heinous crimes, of getting a standard of care or health care significantly higher than they're getting themselves.
My perspective on someone who's been behind the walls and been inside that system, and so I understand it very clearly.
You heard it right. Paul was incarcerated. He did time in San Quentin, but today he says he's clean and sober. And a certified counselor at Core Medical Clinic. He says many of those inmates would have qualified for free Hep-C medications on the outside before going to prison.
So they would, you would think that if they would be eligible for that if they were free, then why deny that to them access to those medicines just because they're incarcerated?
Just a 1 month supply of this one cost the CDCR more than $18,000 on top of the other medications used with it.
So we recognize that it is a very expensive medication, so we want to use it judiciously, but on the other hand, we want to prevent significant illness in our population.
If these treatments are applied, whether or not some of the inmates will recontract the disease and have the taxpayers just wasted $50,000.
The CDCR says if an inmate is reinfected, they will likely begin another round of pricey treatment after waiting at least a year. The idea, pay now or a lot more later.
Cirrhosis and liver cancer down the road, which are also extremely difficult and expensive to treat.
It makes financial sense to treat these people. I don't care who it is.
Federal courts have ordered lawmakers to improve medical care in California's correctional facilities. Dave?
All right, live look out at Palladio out in Folsom. Yeah, bye-bye to some sizzle. Time to tame some of that pre-summer sizzle. We're gonna